Hi.
Hi.
Hi, my name is Anais Troncoso and I am a family nurse practitioner student. I will be performing an abdominal assessment on you. Could I
Okay.
have your name, please?
Joanna.
Hi, Joanna. Nice to meet you.
Nice to meet you.
Do you consent to me recording this video as well as uploading it to YouTube?
Yes, I do.
Okay. So we will begin with your abdominal assessment. If you could please go ahead and lie back for me on the exam table. And I have already washed my hands. So we will have your abdomen exposed for the rest of the assessment. If that's okay with you. So first, upon inspection, the patient's abdomen appears to have a normal abdominal contour with no bulging or signs of any herniations around the umbilicus. The patient's sclera and skin were negative for jaundice, and there is no open lesions, scarring, or stripe present on the patient's abdomen upon inspection. So now we will go ahead and move on to the auscultation. So I will start by listening to your abdomen, Joanna, using the diaphragm of my stethoscope.
Okay.
So we will listen to all four quadrants of the abdomen. Okay. So we started with the right upper quadrant. Moved over to the left upper quadrant, now to the left lower quadrant. And finally, the right lower quadrant. So the patient, we listened to the patient's abdomen. We also did the patient's abdomen for about 3 to 5 minutes. We heard active bowel sounds, and now I will go ahead and auscultate again using the bell of my stethoscope, and we will listen to the patient's abdominal arteries. Starting above the umbilicus, I will listen for the aorta. Okay, so no bruise or thrills heard upon auscultation of the aorta. Normal pulsation. Now we will go ahead and listen to the renal arteries. The renal arteries are found on bilateral sides of the height of the umbilicus. The renal arteries were negative for bruise and thrills, and they had a normal pulsation. Now we will move our way down to the iliac arteries, which are bilateral right below the umbilicus. So iliac arteries are with normal pulsation, no bruise or thrills heard upon auscultation. Now we will make our way down to the femoral arteries. Femoral arteries present a normal pulsation, no bruise or thrills heard upon auscultation. So now, Joanna, we will move on to the percussion part of our exam. I will go ahead and take my finger with my non-dominant hand, and you'll feel light taps all throughout your abdomen. If at any time you feel any discomfort, please let me know. So we'll start in the right upper quadrant. Left upper quadrant. And then we'll make our way down to the left lower quadrant and right lower quadrant. So upon percussion of the abdomen, we should hear tympany throughout because there is air, and where we hear dullness, or it is an indicator of an organ or fluid. So now, since I am on this side, I will go ahead and percuss for Joanna's spleen. Joanna's spleen could be found along right below the coastal margin along the left midclavicular line. So the spleen should not be percussed with the, we should not hear for dullness. If we do hear large dull sound, that might be an indicator of an enlarged spleen. So now we will move on to the liver. So to find and percuss Joanna's liver, we will start percussing at the umbilicus, up like at the level of the umbilicus, down the right the midclavicular line. So we will actually measure for Joanna's liver span. So in order to that, I will go ahead and collect my supplies. Okay, so via percussion, we will start percussing from the moment we hear timpani all the way till when we start hearing dullness. Okay, once I found my my indicator of the bottom the bottom portion of the liver, I will go ahead and mark my spot. And then in order to find the top of the liver, I will start percussing right below the nipple line until I hear dullness. Okay. So then I will go ahead and take my measuring tape and measure Joanna's liver span. And we should find a liver span. A normal liver is between 6 to 12 inches, and Joanna is within norm. I'm sorry, I said inches and I meant centimeters. So now we will go ahead and continue with the palpation portion of our exam. So now we'll turn back to the other side. Okay, Joanna. So we will start by doing light palpation of your abdomen. You'll feel me doing some light pressure all throughout your abdomen. If you feel any pain or tenderness, please let me know. We'll palpate. One. Okay, so palpating the right upper quadrant. Now we will palpate the left upper quadrant, left lower quadrant, and then the right lower quadrant. And one thing, since we are here already, Joanna, we're gonna go ahead and palpate for your bladder. Percuss for your bladder. Okay. So upon percussion, Joanna, timpani can be heard in Joanna's bladder because she emptied it before the examination. If we were to hear dullness, it could be an indicator of a distended bladder. So now going back to our palpation, we will now begin with deep palpation, Joanna. So now you will feel slightly stronger pressure from my finger tips. So we are palpating for any masses, any pain or tenderness.
No, just take pleasures.
Okay. Okay. So now, so no masses were found. So now we will go ahead and since I am on this side, I will go and palpate for Joanna's spleen. So Joanna, I will ask Joanna to take a deep breath. So we will do this upon inspiration of the patient. So I will find your coastal margin. I'm gonna put my hand under your back and go ahead and take a breath in for Joanna. Okay. Thank you. So again, the spleen should not be felt because she is not presenting an enlarged spleen. If we were able to feel it upon the palpation and inspiration, it wouldn't be an indicator of an enlarged spleen. So now I will move on to her liver. Okay. So we will go ahead and I will place my hand under your back, Joanna, and then I will put my hand right below your costal margin here. So go ahead and take a breath in for me, Joanna. Thank you. And this liver is palpable upon inspiration, and this is for the patient. So before we conclude our test, there are a couple special tests that we can perform on the patient. One of them is the fluid weight test to assess for ascites, and the next is the Murphy's for cholecystitis. So in this case, we would go to the patient's right lower margin of the rib cage, right where the gallbladder is found, and then I would have the patient take a deep breath, and then go ahead and release it. And if there is any pain on inspiration, the patient would be positive for Murphy's sign indicating cholecystitis. During our abdominal assessment, we also assess for McBurney's sign, which is a positive indicator of appendicitis. So here we would look for McBurney's point, which is found between the umbilicus and the right superior anterior iliac crest ankle, and right about about 2/3 of it is where McBurney's point is. So I will go ahead and depress this area. Any tenderness? No. So if any rebound tenderness was to be found, the patient would be positive for appendicitis. So now, Joanna, one last special test we do is to check for any costovertebral tenderness. So go ahead and sit up for me. So this is to assess if there is any issues or inflammation with the kidneys. So I will find the costovertebral angle, and bilaterally I will go ahead and lightly pat Joanna's back. So let me know if there's any tenderness, Joanna.
No.
Okay. So no tenderness felt bilaterally. No CVA tenderness felt bilaterally. Okay, Joanna. Well, I think we have pretty much concluded our abdominal assessment. The nurse will be back in to assist you. You can go ahead and get dressed. And thank you so much for today.
Thank you.